Hi, my name's Teresa. How can we help you today?
I've got a really sore back.
You've got a sore back, and what's your name?
My name's Sarah.
Sarah. And have you had a sore back in the past?
No, I tripped over the cat before and yeah, my back's quite sore.
When did you trip over the cat?
Yesterday.
Yesterday. Okay. And the back pain, can you describe it for me?
It's a sharp pain in my lower back.
Yeah.
Yeah.
And does it go anywhere?
No, it's just in one spot.
Okay. So you don't have any old sensation in your legs?
No.
No, you don't have any pins and needles in your toes?
No.
No? Okay. And when you tripped, did you hurt anything else?
No, just my back.
Just your back?
Yeah.
Okay. And have you ever had a back injury in the past?
No.
It's the first time you've ever hurt your back?
Yep.
So this was yesterday. What have you done to help the back pain and
I've just sort of sat here.
Right.
Yeah, I haven't done anything. I've taken some Panadol and ibuprofen.
Okay. When did you take the pain relief last?
About an hour ago.
Okay. And how many paracetamol did you take?
Two.
Okay.
2 tablets.
And how many ibuprofen or brufen did you take?
Just one.
Just one tablet?
Yep.
Okay. About an hour ago?
Yep.
Right. So, Sarah, when you go to move,
Yep.
does the pain get worse or?
Yep.
Yep. So is it better for you to be lying, standing or sitting?
Well, it's better for me to be sitting, but once I get up and moving, it's not too bad.
Okay,
But
it's that effort of getting up and moving around.
and having that pain, yeah.
Right. Have you had any problems going to the toilet in the
No.
last 24 hours since you've hurt yourself? No?
No.
Alright. And you've managed to eat and drink something while you've been in pain?
Yep.
Yeah. Okay. When did you last have something to eat and drink?
Probably about 2 hours ago.
Okay. So, Sarah, do you mind if I just have a wee look at your back? Is that okay? I'm
That's
just going to
fine.
pop up and have a wee feel. So I'm just going to start up here. Sometimes it hurts in other places that you haven't realised. I'm just going to go down and just, if there's any pain, just let me know.
Yep.
Pain just in there?
Yep.
Okay, I'm just going to be really gentle. And no pain down here?
No.
So Sarah, when you go to stand up and walk, do you find if you've got any pain in your hips?
No.
No?
No.
Okay, and you don't feel like you're walking on cotton wool or anything like that?
No.
Alright, and is the pain central or is it to the left or right?
It's just in the middle.
It's in the middle, so
Yep.
it's central.
Yep.
Alrighty. Have you got any other medical problems?
No.
No? And do you take any medications normally?
No.
Okay, do you have allergies to anything?
No.
Right, and so you obviously have paracetamol and ibuprofen in the house. So, Sarah, how much do you weigh?
85 kilos.
85. And your pain, if you had to give that a number out of 10, 10 is the worst pain you've ever had, 0 is nothing, what would you give your pain score at the moment?
Probably a 6 out of 10.
6 out of 10. Has it been worse?
Yeah.
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 So what's made it better? The medication that you've had?
Yeah, I think so, yeah.
Right.
And just the positioning I'm sitting in, and
Right.
it makes it a bit better.
Alrighty. So Sarah, if the pain gets worse than what it is now, we can give you some more medication if you like. You can refuse, but we can give you some more
That'd be
paracetamol,
good.
and we can give you some more ibuprofen. And we can also give you a medication called tramadol. And you're not allergic to anything. Have you ever
No.
had tramadol before?
No.
Okay, so tramadol is quite a strong pain relief. It's really quite good for this sort of pain that you've got in your back.
Okay.
It just helps to get you on top of that pain and get you moving a bit freer. Sarah, look, it'll be really good to see if we can get you out of the chair and see what you like on your feet.
Yep.
If you like, I can give you a hand. Would that be okay?
Yep.
Okay. So I'm just going to put my hand here and just give you a hand to get up. Alrighty, what I'd like you to do is walk over to your table and don't trip over the cat that's there. And just come on back. How does that feel standing?
Yeah, not too bad.
Right. Okay. So take a wee seat there. Sarah, what I need to do is just take your temperature in your ear. We've got a temperature there of 36.4, and I'd just like to take your pulse as well. So how's the cat?
Yeah, the cat's alright.
So you've never had a history of back problems in the past?
No.
You haven't been to see your GP about it this time?
No.
So you've tried to manage it by yourself?
Yeah.
Excellent, well done. So your heart rate is sitting around about 84, which is okay for you. We've got a flag system. It's called the red, orange and green flag. Depending on where the flag system is will depend on what we're going to do with you, and I'll have a chat to you about a plan of action. So let's have a wee look at my flags. So Sarah, have you got any history of cancer?
No.
No? Okay. And you're not using any medications? You're not on steroids or anything?
No.
Fantastic. And the pain that you get, like over the night time, was it worse when you were lying down, or was it better when you were lying down?
Better when I'm lying down.
Yeah. Okay, fantastic. And you've got no altered sensational power in your legs?
No.
Okay. You don't have a problem with osteoporosis?
No.
Okay, and one other little thing I need to ask you about is IV drugs. You're not an IV drug user?
No.
Great, alrighty. Your blood, your heart rate and temperature are fine. I'll probably do blood pressure very shortly. We'll just check that out. When you were walking, you didn't have any altered sensation?
No.
When you were walking?
No.
Alright.
It's just that effort getting up.
Yeah, alrighty. And you're generally well. You haven't been unwell, fluey or anything like that?
I'm generally well.
Well, great. Alright. So the procedures that I've got here suggest to me that you can probably manage this at home with some proper pain management. That's appropriate for you, and then we can look at maybe referring you to your GP tomorrow once you've had a bit of sleep tonight. It's about getting you comfortable. We can potentially take you to after hours, but in South Canterbury we don't have an after hours service. It is the hospital. I think you'll be more beneficial to be in your own bed with some proper pain relief. Do you live here by yourself?
Yeah.
Do you have a phone handy by your bed that you can access? So if the pain should get worse or you get stuck in bed, that you can call for help.
Yep.
Yeah, and obviously you can call the ambulance back if things deteriorate.
Yep.
So there's a wee few things that we're going to do there, give you some pain relief, make sure you're comfortable, leave you some paperwork. I'm just going to write some paperwork up shortly, and tomorrow morning you need to ring your GP and get an appointment with the practice. The other option you got is actually going to physio. If you've got a physio that you go to regularly, you can give them a ring and they might be able to fit you in for some treatment as well.
Sounds like a plan.
Okay, great. I'll go and get the paperwork and medications. Hi Sarah, my name's Teresa, and it looks like you may have hurt your wrist today.
Yes, I have. It's so sore.
Okay, what did you do to it?
Oh, I tripped over the bloody cat.
Okay, and did you land on your wrist?
Yeah, I stuck my hand out.
So you fell on your outstretched hand?
Yeah.
Okay, so we call that a fish, fell on outstretched hand. What time did you do this?
Probably about 20 minutes ago.
Okay, and are you able to move your hand at all?
No.
Are you able to make a fist like I just have? Can you move your thumb or fingers without it hurting?
Just a little bit.
Just a little
Sore.
bit? So can you show me whereabouts exactly it's sore?
Just in here.
Just in
where I'm holding it, yeah.
In the base of the thumb? Excellent, okay. Have you taken any pain relief for it?
No, I can't really. I'm just trying to hold it because it's so sore.
Okay. So is it more comfortable in that position that you've got it in?
Yeah.
Okay, rightio. So what I want you to do is just try and release a little bit, because your hand's actually going a little bit below.
Yeah.
You've got a natural alignment, so that's really good. I need to just inspect the site to make sure that it's just the wrist. So when you tripped and fell, it's only the wrist that's you've injured?
Yeah.
You haven't injured anything else?
Yeah.
Have you ever broken a bone before?
No.
No. And have you got any medical problems that we need to be aware of?
No.
Do you take medications?
No.
Allergies to anything?
Not that I know of.
No. And when did you last have something to eat and drink?
At lunchtime.
Great. See, the colour of your hand isn't quite so blue now, so you just need to relax a little bit. I just need to take your pulse. So you last ate at lunchtime, and today it's about 8 o'clock. So you haven't had dinner yet?
Not yet. I was just about to get some dinner.
Okay. Feeding the cat first, were you?
Yeah.
Yeah.
Yep.
They kind of like that, don't they?
Mm.
Okay. So now that you've released your hand a little bit, you're doing really well with splinting it. Can you move your fingers at all? Good, excellent. Alrighty, and you've got no watch or rings on, so that's really good.
No.
I think it'll be really helpful to put your arm in a bit of a cardboard splint. Would you like me to go ahead and do that?
Yep.
Alright. Put a wee cardboard splint on you. Normally we'd have it in something. Cardboard splint.
Yep.
Do you think you can turn your hand around now that you've got your it's on a cardboard splint? That's it. Well done. Excellent. Very good. So I can have a look at this arm and make sure that it's all intact. And what I'm going to get you to do is I'm going to actually put this in between your thumb and fingers. Can we just sneak that in there?
Yeah.
And you can kind of grip onto that, and I'll make it a little bit more comfortable.
Mm-hmm.
We'll just bring that through a little bit. Alright. So this cardboard splint, I'm just going to bring that around there.
Yep.
And I'm going to get you with your other hand just to hold it underneath.
Mm-hmm.
And there's no need for packing in there. I'm just going to pop a wee bandage around it. So, what have you had for pain relief?
Nothing.
Nothing?
No.
And what do you normally take for pain relief?
I've just got Panadol at home.
Right.
Yep.
Okay. Alrighty. So what I'd like you to do is just try and stretch those fingers out over that packaging there. Great, and you can feel me touching your fingers.
Yep.
Great. And where's your wee thumb gone? Just your wee thumb in there. You can feel me touching your thumb?
Yep.
Fantastic. Alrighty, and if you just want to rest that on your knee, I'm just going to have a wee feel of your wrist again, just your pulse, just to make sure that's good. Okay, is that feeling a little bit more comfortable?
Yeah, it feels a lot comfortable in there. Yep.
So, Sarah, what I'd like to do now is actually just get you to just naturally lift your arm up and put it up to your chest there, and just support your elbow. It's just a little bit long for you, and I'll go and get a sling so we can elevate it, and you might find that the pain settles down a little bit.
Okay.
So pain scores 0 to 10. 0 is no pain, 10's pretty bad, severe pain. What would you rate their wrist at?
Probably a 7.
About a 7?
Yep.
Okay, and you've had no pain relief, and
No.
you're not allergic to anything?
No.
Alright. Have you ever had ibuprofen and tramadol before?
No.
No? So what I'd like to do, Sarah, is to give you some pain relief.
Okay.
And we've got a bit of a cocktail of medications to give you. We've got
Yep.
some paracetamol. Do you know how much you weigh?
No.
No? So would you be over 80 kgs?
Yep.
So we'll probably give you 1.5 grams, which is 3 tablets of paracetamol.
Yep.
And we'll probably give you 600 milligrams, which is 3 tablets of ibuprofen. And I'd like to give you some tramadol as well. That bone pain can be quite uncomfortable and really sore.
Yep.
And because we live in South Canterbury, we don't have access to after hour care, and it is after 8 o'clock at night. And you probably should have an x-ray, so
Yep.
we'll give you some pain relief just to make you a little bit more comfortable, and we'll pop you out to the truck, out to the ambulance, and take you up to hospital. They can x-ray your arm and just see what's happening. Just go and get a sling, and I'll be back in a minute.
Okay,
We'll start
thank
some
you.
paperwork when we've done all that.
Thank you.
Okay. Hi, I'm Teresa,
Hi, I'm Sarah.
and how can we help you today, Sarah?
I've just got this throbbing headache.
Okay, and how long have you had the headache for?
About 2 hours.
Have you ever had a headache before?
Yeah, but not like this one.
So what makes this one different to your other ones?
Well, usually I come right after an hour or so.
Right.
But just haven't come right after this one.
Okay, what do you normally do to get rid of your headaches?
Normally I just take some Panadol and go and lie down till it goes away.
Okay, and have you done that this time?
Yeah, I've taken some Panadol.
How much paracetamol have you taken?
I just took 2 tablets.
2 tablets?
Not sure.
And do you know what time you took them?
Probably about an hour ago.
An hour ago.
Yeah.
Okay. So your headache, whereabouts is it in your position in your head?
Just behind my eyes. Yeah.
Okay. And how's your vision?
Yeah, vision's not too bad. It gets a bit blurry, but it sort of comes right.
Okay. You're feeling a bit blurry around the vision. Have you got any other issues with your headache?
No, just the throbbing feeling behind my eyes.
Okay. Do you feel sick or have you vomited with your headache?
No.
No?
No.
So no nausea?
No.
Okay. Have you had much to eat or drink today?
I've had breakfast.
Yeah.
Yeah, but I haven't had anything to eat.
Okay, so it's now about 8 o'clock
Yeah.
in the evening time. So what time was breakfast? About 12 hours ago?
Yeah.
Yeah, so you haven't had anything to eat since then. What about drink? What have you had to drink?
I've just had a cup of tea and a couple of V energy drinks.
Right.
Yeah.
Okay. And no water?
No.
Have you been at work today?
Yeah.
Right. Okay. So can I get you just to stick your tongue out there for a wee minute? You're pretty dry. Gosh, you are really dry, aren't you? Do you find that with your headaches in the past it's been related to dehydration or?
Yeah, it could be, yeah. I do sort of drink more of the energy drinks than water.
Okay. So you, this headache's different to your other ones?
Yeah.
So while I'm talking to you, do you mind if I just do a few tests like a blood pressure and take your heart rate and all those sort of things? Is that okay?
Yeah, that's
fantastic. So I'm just going to borrow your arm and just pull that top one up. So are you on any medications normally?
No.
No?
No.
Are you allergic to anything?
Not that I know of.
Right, okay. And you took paracetamol about an hour ago.
Yep.
Any reason why just paracetamol and nothing else?
Well, that's all I've got, so...
Right. I'm just going to get you to relax your arm on your leg there, and I'm just going to take your pulse first while I'm talking to you. Now, do you know what day it is today?
It's Tuesday.
Yeah, and what month we're in?
May.
And what year it is?
2015.
And who's the Prime Minister of New Zealand?
John Key.
Great. And you've had no trauma or anything? You haven't slipped, fallen?
No.
Okay, have you been around anybody who has got flu-like symptoms or anything in the last 48 hours? Nobody at work?
No, I sort of work by myself, so...
Oh, okay. Right. So I find that your pulse rate's pretty good and regular. It's about 80, and your blood pressure, that's pretty okay as well. Yep. So with your headaches, you said that you've had a history of them. Would they call them migraines in the past? Or?
Yeah, well, I guess so, yeah, because I usually go to bed and wake up and feel better, and the light sort of makes them feel a
bit funny. Yeah, okay. So I'm just going to take your temperature here while we're still talking. So any other medical history?
No.
No, not at all. So you're fit, healthy young woman? Okay. So your temperature's 36.4, and that's all good. What I'd like you to do is just take your glasses off, and I'm just going to check your pupils. So just keep looking at me. When did you have your glasses last checked?
They're relatively new.
Right. So new as in the last couple of weeks? Or?
Probably about the last couple of months.
Okay. Yeah. Have you had any ongoing issues with headaches with your new glasses? Yeah,
well, when I first got them, yeah. But they seem to come right.
Bit of adjustment sometimes, don't they?
Yeah.
So your pupils are good. They're equal in size and they're reacting to my light. Did the light going into them make them a little bit worse? The pain a bit worse than back?
Yeah, it sort of did, yeah.
Okay.
Yeah.
So if you had to give me a score out of 10, 10's the worst pain and 0 is nothing, what would your headache pain be?
Probably about a 4.
About a 4?
Yeah.
Okay. So you've had some paracetamol, did that help at all?
Yeah, a wee bit, but it's still there. I would have hoped for it to go.
Right.
But yeah,
it hasn't gone, and so that's why you called us?
Yeah.
Okay. So this is my procedures that I've got, and we've just got some red flags, orange flags and green flags as to where we go next with you. So you're talking to me about having a known migraine history in the past with headaches. This is a little bit different to the normal migraine that you have. Your vital signs are all normal, your heart rate, your blood pressure are pretty good. Your temperature's okay, you don't have any high temperature, so that's good. So what I'm going to do next is just get you pop your glasses back on so we don't ruin them.
Okay.
And I'm just going to get you just to grab my fingers and just squeeze really tight as you can. I promise you won't break my fingers. Nice and tight, that's excellent. So what I'd like you to do now is just bring your arms out in front of you and then close your eyes and turn your hands over, pretend like you've got a bowl of soup in your hands and just keep your hands up. Fantastic, excellent, and just really open your eyes and relax. So what I'd like you to do now is just to stand yourself up and see if you can walk over to the table and back. Are you alright getting up?
Yeah.
Too dizzy or woozy?
Yeah.
Excellent. And just to clarify with you, you've only had paracetamol 1 gram about an hour ago.
Yes.
Is there any reason why you might not have had anything else like ibuprofen?
Just didn't think of it. No.
Okay. Have you ever had tramadol before?
No.
Okay, so we've got a little selection of medication that we can give you to help ease your headache. At this stage, I don't think that we need to worry about taking you to hospital, because I think we need to be able to manage this. But you do need to be checking up with your GP.
Okay.
All the after hours. Now in South Canterbury, we don't really have an after hours service. It is the emergency department. So we'll look at giving you some ibuprofen. Do you happen to know how much you weigh?
No.
Okay, you'll be over 80 kgs?
Yeah.
Yeah, so we'll probably give you 600 milligrams of ibuprofen.
Yeah.
And we could probably give you another 500 milligrams of paracetamol.
Okay.
Your pain is about a 4 out of 10.
Yeah.
Okay, so we'll probably give you that medication and you can try that. If your headache gets worse, if your symptoms start to deteriorate, if you start to feel sick, or you think that you need to be reviewed a lot sooner, you'll need to go and see a GP a bit quicker, or head to the hospital, or call us back if things should deteriorate quite rapidly. Are you here by yourself?
Yep.
Do you have a phone by your bed?
Yep.
Great, so you'll be able to have access to a phone. Lovely. Okay, well I'm just going to do some paperwork now and write out a plan of care for you.
Okay.
And then I'll go over that again so that you're understanding and go and get you some medication.
Thank you.
Alright, I'll be back in a tick. Hi Sarah, my name's Teresa. I see you've got a bit of a problem with your nose there.
Yes, it won't stop bleeding.
Okay, how long have you had a bleeding nose for?
Probably about 5 to 10 minutes now.
5 to 10 minutes, okay. Let's just move you forward a little minute. Okay, now what I want you to do is to actually pinch. Pop your glasses off for me.
Yep.
That's it. And we'll just pop them over here on the table on the chair. And what I want you to do is to just squeeze the bridge of your nose rather than here. And I do have something out of my bag, and we'll just give you a wee bolus just to hold on to. Just to put underneath your nose. Use the other hand there. So have you ever had bleeding noses before?
No.
No? Okay, and what's caused this bleeding nose?
I'm not sure. I just come home from work and I sort of hit my nose just because it was itchy, and then it just started bleeding.
You hit your nose?
And I just sort of went like that.
Oh, okay.
Because it was itchy and it just started bleeding.
Right. Alright. Do you have any medical problems like bleeding disorders? Or
No.
Are you on any medications that thin your blood?
No.
No? Do you take any medications at all?
No.
Are you allergic to anything?
Not that I know of.
No?
No.
Okay. So does that feel like the bleeding stopped a little bit now you're pinching on the
Yeah,
bridge
it
of
feels
the
a
nose?
bit more controlled, yeah.
Okay, so you just probably need to just move your fingers up a little bit more and just pinch quite firmly. And what we will do is go and get you a cold compress for the back of your neck because that'll help as well. What's your blood pressure normally doing?
It's normally pretty good, yeah.
Yeah, okay. So what we might do in a couple of minutes is do your blood pressure, but just while you're holding on to your bolster there and collect any drips, I'm just going to take your heart rate. Sarah, have you noticed that the blood's coming out of one nostril or the other, or both?
Oh, I'm not sure. I haven't really looked. I've just seen it.
Right. So Sarah, what I'd like you to do is just to move those fingers up just a little bit higher, because it needs to be quite high and quite a bit of firm pressure, and just bring this arm down. I just want to have a wee look at your nose. Okay. So there seems to be a little bit of blood trickling out this side, but not the other side.
Okay.
Well, that's really good. Okay. Can you just open your mouth a wee minute and stick your tongue out? No blood coming? You can't feel any blood or clots coming down the back of your throat?
No.
Oh, that's excellent. Okay, just pop that bolster back in there. I'm just going to take your heart rate while I'm sitting here with you. And the cold compress is on its way. So with you whacking your nose, it was just with your hand that you hit your nose?
I just had a bit of an itch and I must have hit my nose too hard.
Right, okay. Heart rate's pounding away there quite a bit.
Yeah.
Do you notice sometimes that your heart pounds?
No, I don't notice it though.
Right, and have you had any problems with your blood pressure?
No.
No?
No.
Okay, alrighty. So what I want you to do is just to relax this hand a little bit, but keep that other hand firmly on your nose. If you bring this hand down, and I'm just going to do your blood pressure while you're sitting there. So it's just been a trickle. Did you notice what colour the blood is?
Red.
Alright, so it's not as bright red, it's not like a dark red?
No.
Okay, great. So I've checked your blood pressure, and your blood pressure is actually reasonably good. It's 120 on 80.
Okay.
So there'll be your blood pressure's not high. Sometimes a high blood pressure can cause your nose to bleed.
Yeah.
So that's not a problem for you right now. So as you said, you've probably knocked your nose and given a bit of trauma.
Yeah.
So what we might do is we'll give you a tissue in a couple of minutes, and I'll get a wet towel and pop it in front of you. We'll get you a tissue, and I'll get you just to blow the nose just very gently.
Yeah.
And we'll just see what happens after that. You may need a little bit of treatment. We might need to pop a little bit of adrenaline up your nose,
Okay.
just to see if we can stop that bleeding. It's not too severe at the moment that I can see, so that's why I'm quite happy to actually let you relax your nose now, and we'll get you to just to blow your nostril into the tissue here, and we'll see what happens. Okay, and while we're just waiting to see what happens, I'll start some paperwork, and if the nose stays in this position where it's not bleeding, then we won't be needing to take you anywhere to GP or the hospital immediately. But I suggest that maybe if you keep having problems with your nose, you might need to go and see your GP. Certainly if it continues to bleed constantly, then you'll need to go to see after hours sooner rather than waiting to see GP the next day, or up to hospital if you start to feel a little bit unwell with your nosebleed.
Okay, thank you.
Okay.